Today's our group gonna present about our topic, which is factor contributing to risk of suicide among adolescents. This is our group member. Adolescence is a very important phase of growth and development because it involves major change in terms of emotion, psychology, and social. In this phase, adolescents will face various pressures that can cause them to experience emotional distress and stress. Among them are academic pressure, family problem, peer-related problem, and other issues. In recent years, mental health issues among adolescents have received increasing attention as they are closely related to negative effects including depression, anxiety, and suicidal behavior. Therefore, suicide among adolescents has become a serious public health concern, requiring a deeper understanding of the factors that contribute to the risk of suicidal tendencies among this group.
Problem statement. Adolescent suicide is a serious global public health concern. Rate of suicidal ideation and attempt among adolescents are increasing. Physiological and environmental factors such as depression, anxiety, ACEs, and self-loathing increasing suicide risk. Adolescent exposures to adverse childhood experience are more likely to negative emotional outcome. The maximize linking adverse childhood experience to suicide risk are not well understood. Empirical evidence explaining this relationship remain limited. The mitigating role of the self-loathing has not been adequately explored. This gap highlights the need for targeted suicide prevention and early intervention strategies.
Research objective 1 is to identify internal and external factors contributing to suicidal thoughts and attempts among adolescents. 2. To identify early warning signs of suicidal tendencies among adolescents. 3. To analyze effective preventive measures to reduce the risk of suicide among adolescents. Research question. In Objective 1, researchers can create questions about internal and external factors, influence of physiological factors such as emotional stress and depression, influence of environmental factors such as family, school, and peer, and dominant factor driving suicidal among adolescents. In Objective 2, researchers can create questions about early warning signs of suicidal, behavior change of adolescents, emotional and social change, academic and communication signs, and parents and teachers' function if there is early warning sign of adolescent suicide. In Objective 3, researchers can create questions about preventive measures, effectiveness of family support, role of school in prevention, professional support, and most suitable preventive approach. Literature review. Literature review is a critical examination and synthesis of previous study related to research topic. It purposes summarizing sources. It evaluates, compares, and integrates findings to highlight trends, debates, and unresolved issues. It includes landmark study, recent development, and relevant theories, ensuring the research is grounded in the broader academic conversation. Importance of literature review is contextualization. Position study with the existing body of knowledge showing how it connects to or differs from past work. The second one is gap identification. Reveals what has not yet been studied, helping justify the originality and necessity of research. The third one is credibility. Demonstrate that you are well informed, strengthening the persuasiveness of proposal to viewers or founders. The last one is direction. Help refine research question, objective, and scope by learning from past success and limitation. The first factor is mental disorder and depression. Research on suicide attempts among Muslim adolescents show that depression, stress, anxiety, and hopelessness are the main contributing factors by Maniam 2040 and Ibrahim 2040. In one case study, 5 participants aged 17 to 25 who had previously attempted suicide were interviewed. One participant reported that overwhelming sadness often developed into a severe depression. These findings are supported by Ibrahim 2040 and John 2011, who emphasized that depression increased suicide ideation, especially among adolescents facing social and physiological pressure. Overall, this study highlights that depression is a central risk factor, while positive family support plays a crucial role in helping adolescents during emotional distress. The second one is family factor. The study analysis of risk factor affecting suicidal ideation among public university students in Malaysia using analytic hierarchy process highlight that family factor can strongly influence adolescent suicidal behavior. Issues such as child abuse, parental drug or alcohol addiction, dis- divorce, and poor family relationship are closely linked to suicidal tendencies among youth by Costa 2019, Abdul 2020, Bislan 2018, Junior 2020, and Jusnani 2020. Other than that, negative parental behavior often can make adolescents feel unloved, worthless, and a burden, which can lead them to view suicide as a solution. However, Sumarni 2022 emphasized that parents can act as role models by engaging with their children as friends, mentors, facilitators, and motivators. Parents' knowledge of mental health, suicide warning signs, and supportive practice is crucial in preventing suicidal behavior. The third factor is drug use. The article namely Factor, Treats and Solution to Suicide in Malaysia by Muhammad Razi Abu Amin, Jonas Jawan and Kamarul Azmi Jazmi 2021 identified that mental disorder, depression, alieness of injury, trauma, financial loss, and drug-related problems as major suicide risk factors. Adolescents are particularly vulnerable to drug abuse, often influenced by their family, peers, and environment. Muhammad and Jusam 2015 note that drugs and mental health issues are closely linked as substance abuse can cause hallucination, delusion, and aggressive behavior, and sometimes leading to suicide whether intentional or not. Beyond harming the individual, drug abuse also endangers the wider community and also contributing to criminal cases and social instability. The last factor is bullying. The article, namely Bullying, Cyberbullying, and Suicide, highlight that bullying is a major risk factor for suicidal tendencies among adolescents. Negative peer experience such as social exclusion, rejection, and bullying significantly increase suicidal thoughts and behavior. Bullying is strongly linked to depression, hopelessness, and long-term social isolation by Hinduja and Pechin 2010. Bullying occurs in both traditional form and cyberbullying, with the latter becoming more prevalent due to digital media use. Cyberbullying exposes adolescents to negative online narrative about mental health, further raising suicide risk. Research shows that victims of cyberbullying experience higher level of depression, anxiety, and suicidal thoughts compared to their peers by Zhao 2023.
Research design method. Quantitative research design using a cross-sectional survey approach suitable for examining relationship between adverse childhood experience, self-hatred, and suicide risk. Allow testing of the mitigating role of the self-hatred using a statistical analysis. Method and sources. Data collected using a self-administered standardized questionnaire. Participant adolescent aged 12 to 18 years. Instrument use general information questionnaire for demographic data. Page Q9 for assessment of depression. G87 for assessment of anxiety. Receiver adverse childhood experiences questionnaire. Self-help scale for SHS. Data analysis conducted using SPSS. Statistical analysis include descriptive statistic, correlation analysis, mediation analysis to test the role of self-hatred. Practical consideration involves adolescent and sensitive topics like trauma, self-hatred, and suicide risk. Ethical consideration as extension, informed consent obtained from parent, guardian, and participant. Confidently are anonymity fully ensured. Possible response bias due to self-reported data. Cross-sectional design limit casual interpretation. Potential emotional distress when answering sensitive questions. Physiological support or referral to a counselor provided is needed. External factors like academic pressure, social media use, social environment not comprehensively examined.
Next is implication. Based on the finding of this study, adverse childhood experience such as abuse, neglect, and family conflict are strongly linked to suicide risk among adolescents. This shows that suicide prevention efforts should not focus only on visible symptoms like depression, but also on adolescent early life experience. In addition, the study highlights self-hate as an important internal emotional factor. Adolescents who develop negative self-perception due to traumatic experience are more vulnerable to suicidal death. Therefore, counseling and intervention programs should focus on building self-worth and emotional resilience. Furthermore, early intervention is crucial. Schools, counselors, and policymakers play an important role in identifying at-risk adolescents and providing timely mental health support. Through coordinated effort, adolescent suicide risk can be reduced. Next is contribution to knowledge. The study contributes to existing knowledge by explaining how childhood trauma influence suicide risk through internal emotional processes, particularly self-hate. Rather than viewing trauma as a direct cause alone, the study highlights the psychological mechanism involved. Additionally, the finding refine existing suicide risk models by positioning self-hate as a central factor alongside depression and anxiety. This provides a more comprehensive understanding of adolescent suicidal behavior. Finally, the study enriches the literature by providing empirical evidence from an Asian adolescent population, addressing a gap in previous research and enhancing the cross-cultural relevance of suicide studies.